My name's Annette Cairns. I'm the Organisational Development Manager at Ramsay Health Care UK. We're part of a worldwide organisation, Ramsay Health Care, but in the UK we've got approximately 4,500 employees plus another additional 3,000 bank staff, making up 7,500 employees. We provide healthcare, private healthcare and healthcare to NHS patients across our network of 32 hospitals in England. So what we really enjoy about working with Headlight is that they're really flexible. They're coming up with some new ideas all the time. Every time I go onto the system, there seems to be something else which has just really improved things, either visually or making it much easier to use on the system. And they are really willing to listen to what it is we want and work with us to make sure that we get what we need. We've been working with Headlight for around about 4.5 years. We originally were looking at a 360 to find a 360 which we could benchmark our managers against, what was recognised as good. This is probably where Headlight really challenged our thinking by giving us the opportunity to design our own 360. What we've got is a really flexible system that enables us to use our own competencies, which are linked very closely to the values of Ramsay and Ramsay Australia as well. We've got a 360 which people are able to use to assess where they're strong and also to be able to assess where they've got development areas. We also have a system which means that we can change the questions to keep in line with our organisational strategy. As you know, organisational strategies don't stay stable, which means that what we need from our managers changes. So every year we've been able to look at the 360 competencies we've got and the questions around those and just sense check them to make sure that they're absolutely what we need. And because it's very flexible, we can change them and adapt them and be able to pick up on everything that we need to be able to pick up on. The results are used in a variety of different ways. Because all the levels of management have been involved in doing a 360, they're then shared with the line manager and then the line manager again. So they're shared up and down the organisation. We use the reports with the regional directors so that they can compare their general managers. In the hospitals, we don't tend to use the reports quite so much, but it's more at the senior level. Doctors have to go through a revalidation every 5 years, and the NMC have a 360 that they require them to use with peers, which we felt wasn't going to be as flexible as we wanted it to be, and it would be quite difficult to collect all the questionnaires. So we decided to use Headlight 360. We took the questions from the NMC and loaded it into the system and sent it to all the doctors that we had. And they've been able to nominate their peers for themselves so they can choose whoever they like. And they have managed to get their 360s, get the PDFs of their 360s, which they then take to their appraisal meeting with their responsible officer. And then they have uploaded it to the revalidation system as a PDF. The feedback has been very good. The feedback from those who have really been able to sit down with their managers and work through what it means and build plans has been excellent. Everyone says it's really easy to use. And then when they get the report, it's really colourful, it's really easy to read, and I think the way you can show the same data in different ways to appeal to different people has been really useful. The overriding benefit has been to enable our managers to understand what competencies we're looking for, what exactly as a business we need to be able to have to achieve our overall objectives, and to also see how those competencies, i.e. what we're asking them to do, align to our overall business. When we first started working with the Headlight 360, we worked very closely with one of the consultants who is a business psychologist to help us identify and shape the questions so that they really uncovered our competencies. we did that initially, and then that enabled us to have a bank of questions that would then help us be self-sufficient and adapt as the time went on as we needed to. I do think being able to use the 360 has helped us inform and shape the framework, which is so linked into the values. I don't think before we started with 360 we had a recognisable competency framework. We had the values and we had people who thought they knew what they wanted to do. What this really made us do was think about what we actually needed, and having that has really helped us focus all our learning and development efforts on what we really need, and has given us a much clearer idea of what we need to do next. In summary, we started off thinking we wanted a recognised system that gave us some benchmarks across the world, as it were, and when we looked into it and had a number of different suppliers and providers of 360 show us what they could do, the curved ball that Headlight threw at us made us challenge that. And as a result, we have got a system 3-4 years later which is flexible, it flexes with our business needs, it's been really well accepted in the business, and I think the decision to not go with a recognised framework has been vindicated.